It was very clear here at the American Healthcare Association Quality Summit that quality remains king as new goals were announced here at the summit. Government estimates show that a fifth of the U.S. population will be 65 and older by the year 2050. So Medline and Provider Magazine sat down with owners, administrators, and board members, diving into their challenges and solutions as they continue to see more patients. For 3 days, attendees engaged in discussion and education centered on providing quality for an area of healthcare that is rapidly expanding. But there are concerns. There aren't enough caregivers to keep up with the demand. More than 1 million vacancies are expected for nurses through 2022. Howie Groff with Tealwood Senior Living in Minnesota says they are tackling this issue too.
We operate both metro and rural. Especially in the rural, people will jump for 25 cents an hour. So we've started recognition programs every quarter. We identify 3 staff members at each location, give them both a monetary and a little party reward. Second piece is just wage rates. Thirdly, we're doing tuition reimbursement.
A second challenge attendees are seeing is consumerism. R&G Healthcare Management's Gerald Hamilton says his facilities are also working with patients making more informed decisions.
They do a lot of research before they come to see us or before they contact us. So we've got to make sure that all of that information that we share is accurate.
To address the rising acuity of the patient population, Elena Wolf says at Sunrise Senior Living, they work with third-party vendors to allow those patients to age in place in their communities.
Focusing on outside relationships and really working collaboratively with suppliers and partners and vendors such as Medline, and you guys being able to really help us solve for problems with clinically complex residents.
With government data showing more than 40% of hospital discharges going to a post-acute setting for Medicare, technology has become the differentiator for Paul Listro and his staff at Vernon Manor and Manchester Manor.
We have some software that helps us on the survey, and what it does is it mimics the survey, and we do it over 13-week periods ongoing throughout the year. So when the surveyors come in and they do what they do, we've already done what they're doing.
Bartley Healthcare's Phil Scallo says it's critical for providers to demonstrate that quality to their referral partners.
If you're good at what you do, be proud of it. And if you're something that's not working that well, get somebody to help you to be good at what you do. So from our perspective, data is power.
And the data is pointing to the need for long-term care providers to work with partners and people outside of their facilities.
The reality of the residents that they're caring for are just as sick, have just as many comorbidities as what we're seeing in the hospital setting. And that's why Medline plays such an important part in advancing quality and elevating evidence-based practice.
With the right partner, resources, and technology, quality does not have to be a fight that facilities fight alone. To learn more about resources to improve quality, you can visit Medline.com's quality page. From New Orleans, I'm Marianne Ostrogorski.